If you can start out, Dr. Michelle, by explaining to our listeners what an OB-GYN doctor actually is.
So, an OBGYN doctor is short for obstetrician and gynecologist. What it really encompasses is we are the experts in women's health. And the first part, the obstetrician part, means that we are taking care of women through their pregnancies and any pregnancy related condition or complication that they may have. You think of someone being pregnant and having a baby, but there's all sorts of things that could potentially happen or go wrong even in the early parts of pregnancy. And so we take care of all of that, including any surgeries that may be related to the pregnancy. The gynecologist part is related to women of all age groups, really, because all women can have reproductive or issues with their female anatomy. And so we can take care of all of those aspects, including any surgeries as well.
What would you say is the best thing you like about being an OB-GYN doctor?
Oh man, there's definitely a lot of happy moments being an OBGYN doctor. We are really there at some pivotal moments in people's lives, not just women's, but whole families. You know, we're making people grandparents for the very first time and dads, and it's a really beautiful thing. Even though sometimes you're up at 3 in the morning delivering a baby, it still gets me. Like, I still feel really happy at those times when we deliver a healthy baby into someone's arms. And I really still enjoy that.
Can you talk a little bit about maybe some of those obstacles you faced, as you go through all of that, but probably some of the big ones, and then how you overcame them?
Medical school, you have to up your game. There's a lot. You're with some very elite students that some of them went through private school their whole lives and were like groomed to go to med school and be doctors. So realizing that I was at best average in med school was hard, and changing your mentality from I'm going to get A's on everything to like, let's just pass these classes and survive. But you go through that fairly quickly and you get very humbled. The amount of material that you have to memorize and get through is a lot. That was hard. Like, you just have to crank out a lot of information in a couple years in med school. There's definitely certain subjects that still to this day I'm like, do I understand the kidney that well? Like,